She built a global empire from something as simple as skin problems, turning dermatology into a cultural phenomenon watched by millions online. Dr. Sandra Lee became known for transforming private insecurities into public fascination, guiding patients through treatments that drew huge audiences and emotional trust. What looked like unstoppable success hid an unexpected vulnerability. One ordinary working day in her Southern California clinic, everything appeared perfectly normal, with cameras rolling and patients arriving as usual. Yet beneath that routine, her body began sending subtle warning signals that something was wrong. A sudden wave of heat passed through her, followed by mental fog and discomfort she could not immediately explain. She dismissed it as exhaustion or hormonal change, pushing forward with her responsibilities. In hindsight, this moment marked the beginning of a medical emergency that would soon challenge everything she had built and believed about control over her own health. Today, a normal clinic day before the shift, it was supposed to be an ordinary day at her busy dermatology clinic in Upland, California, where routine procedures were carried out under bright lights and constant recording for her television and online audience. Patients traveled from across the country, hoping for relief from long-standing skin conditions, placing their trust in her steady hands and calm expertise. The environment was structured, professional, and familiar, leaving little room for unpredictability. Cameras captured each moment as part of her widely followed medical content, while staff moved efficiently between rooms ensuring everything ran smoothly. Dr. Sandra Lee maintained her usual focus, balancing medical precision with the demands of filming and patient care. Nothing in the atmosphere suggested disruption or danger, yet beneath the surface of this controlled setting, her body was already beginning to react in unusual ways, signaling the early stages of a serious medical event that would soon interrupt everything. First signs something was wrong during the course of the day. Subtle changes began to appear in her physical condition, though they were easy to overlook amid the demands of a busy clinic. A sudden sensation of heat moved through her body, followed by a feeling of mental cloudiness that made concentration more difficult than usual. Despite her experience as a physician, she initially attributed these symptoms to stress, fatigue, or perhaps hormonal fluctuations that often go unexamined during intense work schedules. She continued treating patients and managing procedures, relying on discipline to push through discomfort. The symptoms, however, did not fully subside. Instead, they lingered in the background, quietly intensifying. In the fast-paced environment of her practice, there was little opportunity to pause and reflect. What seemed minor at first was actually the beginning of a serious neurological event that would soon escalate beyond anything she could ignore. But she kept pushing forward. Evening symptoms that raised concern during the evening, after leaving the clinic and heading to her parents' home, the discomfort that had started earlier in the day became more pronounced and harder to dismiss. A sharp, unusual pain traveled down her leg, interrupting her ability to move comfortably or find rest. Although she attempted to relax and convince herself that it was nothing serious, her body continued to behave unpredictably. Walking felt slightly unsteady, as if her coordination was not fully aligned. She tried to continue normal conversation and routine activities, but something inside her felt increasingly wrong. Despite her medical background, she still searched for simple explanations such as exhaustion or minor nerve irritation. However, the progression of symptoms suggested something more serious developing beneath the surface. That night, sleep became impossible, as discomfort and unease kept her alert, marking the transition from mild symptoms to a clear medical emergency. Something was very wrong. The morning realization and stroke signs by the following morning. The situation had escalated to a point that could no longer be rationalized or ignored. Simple movements became difficult, and her body no longer responded with the precision she was accustomed to as both a surgeon and a clinician. When she attempted to use her left hand, she noticed a sudden lack of control and strength that immediately alarmed her. Speech also became affected, with words coming out unclear and disorganized. These were not vague symptoms, but direct neurological warning signs that she clearly recognized. Despite this awareness, the shock of experiencing them firsthand created hesitation and disbelief. The possibility of a stroke entered her mind with increasing urgency, as multiple classic symptoms were present at once. Face, speech, and limb function were all being affected simultaneously, leaving little room for alternative explanations or delay in seeking immediate medical attention. She knew she needed help immediately. Denial, despite medical knowledge, even with her extensive medical training, the immediate instinct to minimize her symptoms created hesitation in seeking urgent care. Like many professionals, she initially tried to rationalize what was happening, considering less severe explanations such as stress, fatigue, or temporary nerve issues. This internal conflict between knowledge and emotional denial is common in medical emergencies, where familiarity with symptoms can paradoxically delay action. She was aware of the classic warning signs of stroke, yet experiencing them personally made acceptance difficult. The mind often resists worst-case interpretations, especially when the individual is highly functional and in control of others' health. Despite growing evidence that something serious was occurring, she continued to question whether it was truly an emergency. This brief delay in decision-making is a critical factor in stroke outcomes, where every minute determines the extent of potential brain injury. She still hesitated before calling for help now finally. A father's immediate intervention, the turning point came when her father, also a physician, observed her condition and immediately recognized the severity of the situation. Unlike others who might have hesitated or questioned the symptoms, he acted without delay, understanding that the combination of speech difficulty, weakness, and imbalance pointed strongly toward a neurological emergency. His medical experience allowed him to cut through uncertainty and prioritize urgent action. He instructed her to go to the emergency room immediately, leaving no room for debate or hesitation. This decisive response likely changed the outcome of her condition, as stroke treatment is highly time-sensitive. In such cases, early intervention can significantly reduce long-term brain damage. His reaction highlights the importance of external perspective in medical crises, where patients themselves may underestimate the seriousness of their symptoms. In this instance, professional knowledge combined with parental instinct became a life-saving force. Prompt action saved her life. Emergency diagnosis and brain injury at the hospital, medical teams acted swiftly upon her arrival, conducting immediate neurological assessments and imaging scans to determine the cause of her symptoms. The results confirmed what had been feared, an ischemic stroke caused by a blood clot that had interrupted blood flow to part of her brain. This interruption deprived brain tissue of oxygen, leading to rapid cell death in the affected region. Doctors explained that in stroke cases, every minute without treatment increases the extent of irreversible damage. The phrase "time is brain" reflects the urgency of such conditions. For Dr. Sandra Lee, the diagnosis was both professionally understood and personally devastating. Despite her medical background, hearing confirmation of brain injury within her own body created a profound emotional impact. The realization that part of her brain tissue had already been permanently affected marked a turning point in her understanding of vulnerability. Everything changed in that moment. Professional identity under threat, the consequences of the stroke extended beyond immediate medical concerns, threatening the very foundation of her professional identity. As a surgeon and public medical figure, her career depended on fine motor control, clear communication, and sustained cognitive precision. The affected areas of her brain were directly linked to these abilities, raising concerns about long-term recovery and functional capacity. The realization that her hands, voice, and coordination might not fully return to their previous state was deeply unsettling. Years of training, practice, and public trust were suddenly placed at risk by a single vascular event. For someone who had built a career helping others overcome physical and emotional insecurities, the experience of losing control over her own body created a profound shift in perspective. It forced her to confront the fragility of human health, even for those trained to understand it most deeply. Her confidence in control was deeply shaken. Origins of a medical journey, her story began long before fame, television, or viral videos, rooted in the experiences of her father, who worked in a rural medical setting in Malaysia. Limited resources meant he often relied on a single medical reference book to diagnose and treat patients. This environment shaped his determination to pursue medicine more formally and eventually led him to build a life and career in the United States. His journey laid the foundation for his daughter's path, exposing her early to the realities of health care and patient suffering. Despite this influence, her own path into dermatology was not straightforward. She initially faced rejection from her chosen specialty training, forcing her to reconsider her future direction. However, persistence and dedication eventually brought her back into the field she was passionate about. These early challenges helped shape her resilience and commitment to medicine. Her foundation was built on persistence and determination alone early. Rise of a global digital phenomenon in 2010. She began sharing medical content online through a YouTube channel that initially attracted little attention. The early videos were simple and educational, focusing on dermatological procedures without expecting widespread popularity. However, one particular video featuring a blackhead extraction unexpectedly went viral, capturing global curiosity and transforming her visibility overnight. What started as niche medical content quickly evolved into a cultural phenomenon, drawing millions of viewers fascinated by skin procedures. The internet audience grew rapidly, and her nickname, Dr. Pimple Popper, became widely recognized across platforms. This sudden fame brought opportunities beyond online media, including television shows, product lines, and international recognition. However, the rapid growth also introduced intense pressure, increasing her workload and reducing opportunities for rest. As demand increased, so did her responsibilities, creating a pace that continued accelerating without pause. Her growing success came with increasing demands that slowly began to affect her personal health significantly. Recovery, reflection, and a new perspective following the stroke. Her recovery process was slow, challenging, and filled with uncertainty. For nearly 2 months, she was unable to perform surgeries or film content, and even basic daily tasks required significant effort. Walking, speaking, and using her hands felt different, as though her body was no longer fully aligned with her intentions. The experience created a deep emotional impact as she faced the possibility that certain abilities might not fully return. Returning to work after this period was both physically and psychologically demanding, especially stepping back into the same environment where everything had changed. However, she gradually resumed her responsibilities with caution and awareness. Instead of hiding her experience, she eventually chose to share it publicly, offering insight into the importance of recognizing stroke symptoms early. Her story became not only one of survival, but also of awareness, resilience, and renewed appreciation for health. A blessing in disguise,